So another patient encounter that I had during some of my mentorship time and co-treating time with our staff was an individual who is post-concussion, and she has actually had 2 concussions at this point and is having some lingering effects and symptoms from those concussions. Now, she has returned to her work environment, she's living independently, but she's still struggling at this point with cognitive aspects and recall, and really being able to handle changes in situations when she's under duress, under fatigue, or just in more complex environments in the sense of there's multiple things going on, whether from an exertional standpoint or from a cognitive standpoint. And what tends to really throw her for a loop is when she's presented with something that is new or out of the ordinary from what her typical work routine is or just daily routine is. Now, I'll be the first to admit, we have other members on our staff who have more experience and I would say are more qualified in the concussion field than what I personally am. So if you have questions or you want to go more in depth on anything concussion, I'd highly recommend you consult with Paula McCorkle at our Germantown location or Chris Sorreo at our Frederick location. Both of them are phenomenal PTs. Concussions are something that they're very passionate about, and they can expand off this and do it way more justice than what I can do. But I'll just paint a picture right now for some of the things that we worked on with this individual. The primary PT on this case has been coordinating with the physician who is overseeing this case, relaying to them updates on functional status, what's working, what they're still struggling with, and making sure that there's nothing that's out of the ordinary or kind of off the radar with this individual that would fall them out of the PT scope of practice and warrant further medical attention. So I think that's one disclaimer I want to put out there, is just making sure you're taking a multidisciplinary approach to concussion, keeping all parties informed, and make sure any changes in status or just status updates are going to the appropriate people so that they can help guide and facilitate your plan of care, maybe give you guardrails of how far or how much you can push someone, how conservative you need to be, or just where you can best allocate efforts, especially if you have other healthcare providers that may be providing supplemental or alternative interventions at that time, whether it's pharmacological, whether maybe it is mental health, psychological or emotional, or just other fitness professionals if they're doing things outside of your 4 walls in the PT clinic as well. So with this individual, things that we worked on in this session was keeping exercises familiar for her, meaning exercises that she has done in the past, but changing up some of the additional demands that we were giving her. So this could be something as simple as changing the sequencing of the exercising. So we were going through some different turf-related progressions, some different locomotive patterns, walking, marching, multi-directional movements with both of those, and she's familiar with these. And she usually goes through the routine pretty quickly and pretty mindlessly. So one thing that we played around with was, let's change up the order of them. And let's change up the order of them on the fly. So instead of going walking forwards to walking backwards to walking sideways, what happens if we change that and we go from forward to sideways, or we go from walking to marching, and we do things that she is familiar with and we know that she is competent with from a movement standpoint, but the directions that we're giving to her are something she's not used to. Is she able to process it? Does it influence her movement patterns? Does it influence just her emotional state or her general mood or her general affect? And how may that translate into demands of just activities of daily living or her work status? Other things that we did was incorporate other visual or vestibular demands. So as she's walking, having her carry on a conversation with us, having her count by a series of numbers, having her identify different objects in the room that calls her to move her head, focus on different objects, or maybe we're working on some gaze stabilization where as she's walking, she has to fix her head on an object as she is also moving her head back and forth. So just adding little wrinkles to common tasks that she's doing, seeing if it changes her symptom profile, either from a dizziness standpoint, just from her overall ability to concentrate and carry out the task, or do those increased demands influence her ability to carry out the task of what she was previously able to do. things that we relayed to her was this can influence things such as driving. Can I do something as simple, or I don't want to say simple, but as necessary as driving on a daily basis, where I need to be mindful of where I'm going, what the directions are, what the speed limit is, be able to look around and recognize where traffic is coming from, and still be able to make these real-time decisions very efficiently and very safely in a more higher risk scenario than just walking up and down in clinic. With this individual, one thing that she is entertaining doing is moving out of state. And if she's moving out of state, some of her support system that she has from a family standpoint won't be readily available. And also her work demands, how will they be influenced when she has this drastic change in environment as well? So our overall PT session included some of the things we talked about earlier. From an exercise standpoint, we're continuing just to progress the intensity of the aerobic and anaerobic activity that we do with her, and seeing if that increased exertion level influences her ability to do short or long-term recall throughout the session. That can be something as simple as just giving her a command to repeat or a phrase to remember, and seeing, does that change when we're doing something more or less strenuous? But another big piece that I think I took home from this session was watching the PT and also the PT student that was involved with it interact with the patient, keep her informed and educated on what we were working on, and really connecting the dots of how we were doing things in the clinic and what that carried over, or we were hoping it would carry over into real life activities. But then also communicating that with the patient's daughter, who's been involved with helping transporting her to and from sessions, helping out with odds and ends stuff around the house, and is ultimately going to be involved with the decision making of when and to what capacity the patient may or not be moving, and trying to be a little bit more independent. So a lot of different things going on. I'm just giving you a snapshot of some of the big picture things that we were looking at. But I always think concussion rehab is fascinating, from just the multitude of things that can influence their progression and their performance of a task and their tolerance to a task, but also the multidisciplinary approach and really honing in on where do we fit into this picture as a physical therapist, how can we best serve this individual, and how can we make sure from a communication standpoint we're involving all parties and making this as seamless as possible to best optimize the patient experience, outcomes, and figure out when have we done all that we can provide and we need to refer out or tag out, or when are we maybe transitioning to that primary point of contact for the patient as some of their more pressing medical demands are starting to reduce, and this is more just increasing functionality.